5 health checkups you should never do after 60 can do more harm than good to your health. Senior, there's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for routine health checkups, thinking they're doing everything right, staying safe, and staying ahead of any potential health problems. But what if I told you that some of those tests, the very ones your doctor says you need, could actually be doing more harm than good? What if some of those checkups designed to protect you are pushing you closer to surgery, strokes, or even cancer? New studies reveal a shocking fact. Up to 37% of medical tests for seniors lead to unnecessary treatments, complications, or lifelong side effects. Even more shocking, 99% of people over 70 have no idea they're being over-tested, misled into treatments that could put their health in greater jeopardy. In this video, we're diving deep into 5 health checkups that seniors should avoid after 70, and why these tests may harm you more than help you. We'll uncover the terrifying truth about what these checkups could do to your body, all backed by real science. And trust me, you won't believe what made it to number 2 on our list. Before we begin, let us know in the comments below where you're watching from, your age, and if you've ever regretted a test or procedure. Do you think seniors are being tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Checkup No. 1. Bone density scan. DEXA scan? Bone density scans sound harmless, right? A quick scan, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. But here's the truth no one tells you. After the age of 70, bone density scans, also known as DEXA scans, may create more fear than benefit. What is a bone density scan? The DEXA scan measures the strength of your bones and is primarily used to detect osteoporosis. Osteoporosis is a condition where the bones become brittle and prone to fractures, especially in seniors. The idea is simple: if your bones are weak, you're at risk of breaking them, so knowing your bone density should help prevent fractures. Right? The problem with bone density scans for seniors: here's where things get tricky. In older adults, especially women, the results from a bone density scan almost always show lower density, even when there's no real danger. This is because bone loss is a natural part of aging, just like wrinkles or gray hair. It happens to everyone. The real problem is that doctors often push seniors into taking medications like bisphosphonates, which are designed to strengthen bones. However, these medications come with serious side effects, including rare conditions like jaw necrosis, where the jawbone starts to die, and esophageal irritation. Not exactly what you want when you're trying to stay healthy. The research does medication help? Studies have shown that treating mild bone loss in people over 70 with medications has little to no impact on actual fracture rates. For instance, a study published in the Journal of the American Geriatric Society followed over 1,200 women aged 70 and older and found that bisphosphonates reduced fracture risk by only 0.3% over 5 years. That's a very small benefit compared to the risk of side effects from medication. Let me tell you a real story. Meet Rose, a 76-year-old retired piano teacher. She had never fallen, felt no pain, and walked every day. Her DEXA scan showed she had osteopenia, a mild reduction in bone density, not osteoporosis. Despite having no symptoms, her doctor immediately put her on alendronate, a bisphosphonate. 3 months later, Rose developed severe reflux and jaw pain. By the time we saw her, she hadn't played the piano in weeks. We took her off the meds, put her on a regimen of vitamin D, weight-bearing exercises, and a calcium-rich diet with foods like sardines and leafy greens. A year later, she was back to performing, with stronger legs, better balance, and no fractures. The safer alternative: Lifestyle changes for people over 70 who aren't falling or breaking bones. The better option isn't a scan, it's lifestyle. Studies have shown that strength training, balance exercises, and proper nutrition can reduce fractures by over 20%. So don't let a number on a screen scare you into treatment you may not need. Checkup No. 2. Brain. MRI for memory loss feeling. Forgetful? Confused? As we age, it's natural to experience some memory lapses. But here's what happens next. Your doctor hears about the forgetfulness and immediately suggests a brain MRI. You're worried, so you agree. After all, an MRI is a detailed scan that shows the structure of the brain. But here's the uncomfortable truth. Most MRs in people over 70 show age-related changes, such as slight shrinkage or white matter spots. These are completely normal for older adults. The issue with brain MRIs, once those white matter spots are seen, the doctor might get alarmed. But the real issue here is that those spots are often harmless and don't necessarily indicate anything serious. However, once doctors see something on the MRI, it can trigger further tests, panic, and in some cases, even unnecessary surgery. In 2021, a study reviewed over 3,000 MRI scans of patients aged 70 to 85 who had mild cognitive complaints. 86% showed some form of brain abnormality, but only 3% of those findings were linked to something treatable. That means 97% of people went through unnecessary emotional tolls, anxiety, and invasive tests. Take George, a 74-year-old retired engineer. He had trouble remembering names and misplacing his keys more often. His doctor sent him for an MRI, which showed white matter changes. George panicked, convinced he had dementia. He stopped driving, stopped socializing. But when we reassessed him using a standard cognitive test, his score was completely normal. The truth is, unless there are severe neurological symptoms like seizures, sudden personality changes, or rapid functional decline, an MRI is rarely helpful for mild memory loss. A better first step? A cognitive screening test, a simple paper-based exam that evaluates memory, attention, and problem solving. It's cheap, effective, and avoids unnecessary panic. Checkup No. 3. Cardiac stress test for seniors. Feeling a little fatigued, experiencing chest tightness, or just not feeling as energetic as they used to, often leads them to get a cardiac stress test. It's one of the most common tests given to seniors who complain of these symptoms. But here's the truth: this test, which monitors your heart while you're walking on a treadmill or taking medication that simulates exercise, may do more harm than good after 70, especially when there aren't clear signs of heart disease. What is a cardiac stress test? The cardiac stress test is used to spot blocked arteries and determine how well your heart is functioning during physical activity. During the test, you either walk on a treadmill or receive medication to simulate exercise, while doctors monitor your heart's response. The problem with cardiac stress tests after 70, for seniors over 70 who don't have classic heart disease, symptoms like chest pain during activity, shortness of breath, or significant drops in energy during light exercise. This test can often lead to false positives. A false positive means the test indicates a problem when there is none, which can lead to unnecessary follow-up tests and procedures like angiograms, stent placements, and even bypass surgery. In fact, studies show that the false positive rate for stress tests in adults over 70 can be as high as 40%. This leads to unnecessary treatments and serious risks such as bleeding, kidney injury from contrast dyes, and prolonged hospital stays. The research, does it really help? A study published in JAMA Cardiology in 2017 found that more than half of all stents placed after stress test referrals were done on patients who had no real symptoms or benefits. These patients did not show any improvements in survival or quality of life after the procedure. What they did experience were higher rates of complications and a longer recovery period. Take Raymond, a 75-year-old retired postman who stayed active by walking every day. During a routine checkup, Raymond mentioned feeling tired when walking up hills. His doctor scheduled a stress test just to be sure. The results were unclear, so Raymond was sent for a catheterization, where a small stent was placed due to a mild narrowing of his arteries. That night, he developed kidney problems from the contrast dye. Spending 6 days in the hospital. The fatigue Raymond felt never changed because the fatigue wasn't caused by a heart problem. He simply needed better hydration and more rest. Safer alternative: resting EKG and coronary calcium scan for seniors over 70 who don't have significant heart disease symptoms. Cardiac stress tests can cause more harm than good. Instead, a safer, simpler option is a resting EKG, a test that looks at your heart's rhythm while you're still. Another option is a coronary calcium scan, a low-radiation imaging test that shows whether dangerous plaque is building up in your arteries. These tests are much less likely to lead to unnecessary procedures and are far safer. Checkup No. 4. Colonoscopy. You probably didn't expect to see colonoscopy on this list, but it's worth considering. Colonoscopies are often recommended as part of routine cancer screening after age 50, but after age 70, they may not be as beneficial, and in some cases, can be more harmful than helpful. What is a colonoscopy? A colonoscopy is a procedure in which a doctor uses a long, flexible tube with a camera to examine the inside of your colon for polyps, inflammation, or signs of cancer. While it's important to screen for colon cancer, the risks increase with age, and routine screening for seniors may not always be necessary. The risks of colonoscopy after 70. The preparation for a colonoscopy is harsh, often involving strong laxatives that can cause dehydration, dizziness, or even kidney issues. The sedation used during the procedure also poses added risks to brain function in older adults. Perhaps the most surprising thing is that the test itself can cause complications, such as bleeding, tearing, or even heart rhythm disturbances during sedation. A study published in JAMA Internal Medicine in 2019 followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. When is colonoscopy not necessary? If you're over 75 with no symptoms, no family history of colon cancer, and no significant risk factors, a colonoscopy may not be needed. Even when polyps are found, many are small and slow-growing. Removing them in an older adult can sometimes do more harm than leaving them alone. Dana, a 73-year-old grandmother who ran a small bakery, was urged to get a screening colonoscopy by her new doctor. She had no symptoms, no bleeding, no changes in stool, and no family history of colon cancer. After the procedure, she suffered from intense abdominal pain and fainted, and was diagnosed with a bowel perforation. She spent 9 days in recovery, and hasn't been the same since. The safer alternative: stool-based tests. U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a safer and easier alternative is a stool-based test, such as the FIT, fecal immunochemical test. This non-invasive, at-home test can detect blood in the stool and catch most concerning cases. It's easier to do, with no harsh prep, no sedation, and a far lower risk of complications. Checkup No. 5. Annual full-body CT scans, and now we arrive at the most overused, most dangerous, and most harmful checkup for seniors: full-body CT scans, which are sometimes marketed as part of executive health packages or as preventive services in private clinics are being sold as a way to catch cancer early. But here's the shocking truth. These scans expose your body to high doses of ionizing radiation, which can actually increase the risk of cancer. What is a full-body CT scan? A full-body CT scan is a powerful imaging tool that captures detailed pictures of your organs, tissues, and bones. It's often offered as a way to detect cancer or other serious health conditions in the early stages. The risks of full-body CT scans. While these scans can detect harmless nodules, calcifications, or cysts, which are part of the aging process, the problem arises when they lead to unnecessary follow-up tests, biopsies, and even surgeries. The radiation exposure from these scans is high, ranging from 10 to 20 millisieverts, which is equivalent to about 500 chest X-rays. A 2023 study published in JAMA Internal Medicine found that full-body CT scans might be responsible for up to 5% of all cancers in the United States, which is as high as the cancer risk from drinking alcohol every day. That means 1 in 20 cancers could be caused by a scan that was supposed to prevent disease. The story of Marcus. Marcus, an 80-year-old active senior, felt great. He was teaching martial arts to younger seniors and taking part in regular fitness checkups. During one of his executive health checkups at a private clinic, he underwent a full-body CT scan. The scan showed a tiny 3 millimeters nodule in his lungs. This led to a chain of events. He was referred to oncology, sent for a PET scan, and eventually had a needle biopsy. The result? The nodule was benign, but the biopsy collapsed part of Marcus' lung, leading to hospitalization and a 2-month recovery. Safer approach. Targeted imaging experts advise against using full-body CT scans for general screening in asymptomatic adults. The American College of Radiology is clear. There's no proven benefit and significant potential harm. Instead, if you're experiencing symptoms like unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging is the safer, more effective option. A better approach is listening to your body, maintaining regular checkups with your primary doctor, and only undergoing tests that are clearly indicated. Conclusion. Less is more. So, there you have it, 5 checkups. That may seem helpful, but can actually harm you, especially after age 70. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Before undergoing any test, always ask, what happens next? What if the test finds something? What are the risks? Is the reward worth it? Real prevention starts with lifestyle. Staying active, eating well, sleeping deeply, and choosing your checkups wisely. Your time, energy, and health are too valuable to waste on fear-driven screenings that could leave you worse off than when you started. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences and thoughts in the comments below. We'd love to hear them. Thanks for watching, and don't forget to like, subscribe, and share.